The Dr. Oz Show, weekdays at 4 on News Channel 5.
We track storms down to your street. The Power 5 Doppler Network. Kaleidoscope, a weekly public affairs program brought to you in partnership with the Urban League of Greater Cleveland, Kaleidoscope Magazine, and News Channel 5.
Good morning, everyone. Welcome to the broadcast today. The annual Minority Men's Health Fair takes place at the Cleveland Clinic's main campus in late April. Renal transplant surgeon Dr. Charles Modlin is here to talk more about the event. Then Marsha Brooks and Dolores Groves of Delta Sigma Theta sorority will tell us about the celebration plan for the 100th anniversary of the organization Delta Sigma Theta. Later on the broadcast after that, we'll hear from Doug Miller of Polaris Career Center. He'll talk about a job fair for area residents. A good broadcast we have planned for you today, but don't we always? Good morning. I'm Leon Bibb. This is Kaleidoscope, and so we begin with Dr. Charles Modlin, renal transplant surgeon, Cleveland Clinic. Good to see you, Dr. Modlin.
Yeah, thanks for having me again. Appreciate it.
My good friend, always good to have you on the broadcast. 11 years you've been doing this Minority Men's Health Fair. Here it is again.
Yeah, April the 25th will mark our 11th annual Minority Men's Health Fair that we hold at Cleveland Clinic. We always generally hold it in April, which is Minority Health Month, and it gives us an opportunity to provide free screenings. Our target population is predominantly African American men and other minority males, but we welcome everybody, all males, to come and undergo these free preventative health screenings.
Now, what happens at these health screenings? What do you look at?
Well, we actually do comprehensive health screenings from head to toe. We're screening, one of the most popular screenings for the men is screening for prostate cancer. We screen for high blood pressure, diabetes, cholesterol, hepatitis, HIV. We do colorectal cancer risk assessments, screenings for mental health, depression, all type of screenings. Any screening you can think of, we do.
And of course, if somebody is in serious need of medical attention because of the screenings, they're right there at the clinic.
Well, exactly. I think one thing that distinguishes our Minority Men's Health Fair from many of the health fairs that are out there is that we actually have a Minority Men's Health Center to go along with it. And by that I mean we're actually evaluating and seeing patients throughout the year. We don't just do one event. We're actually there throughout the year. Every Wednesday at the main campus, we hold our Minority Men's Health Center clinics, and every Tuesday over at Stephanie Tubbs Jones Family Health Center. So we're available throughout the year. We actually have about 400 health providers on hand to provide the health screenings at the health fair. We have almost every clinical department and institute at Cleveland Clinic represented doing the health screenings.
Yeah, okay. I'm holding a placard right now, a little information. We can get a shot of that if I can hold it straight there. There you go. Get the glare off of it. That's on April the 25th. Where should people check in now at Cleveland Clinic, or how should they check in? Can they register early?
Well, there is on-site registration. You can go to our website, clevelandclinic.org/MMHC, or just use your web browser, type in Minority Men's Health Fair. It takes about 15 seconds to pre-register. Most men actually register on site, so there's no pre-registration required. You know, Leon, we're actually making a huge difference in the lives of the individuals that attend this health fair. Unfortunately, a lot of men, especially men, just don't want to go to the doctor. And we know that if we can detect many of these diseases in early stages, we can actually cure these conditions. Prostate cancer, for example, is potentially 100% curable if we can detect it in time.
And that prostate cancer is a very simple examination.
It's a simple examination, and you know, if the men don't want the examination, we at least recommend that they get the blood test. It's called a prostate-specific antigen.
The PSA.
The PSA blood test.
But the digital with the finger,
right,
that's vital. I mean, we're talking about saving lives right here, and it's a simple with a 10-15 second test. Right?
Oh, exactly. Every year at the health fair, we detect men with previously unrecognized prostate cancer. You know, one of the most important things I can say to your listening audience is that men can have prostate cancer and have no symptoms. Actually, most men have no symptoms that we find prostate cancer.
So we need to have these tests. I mean, I have these tests every time I go to the doctor's office. We do the test. It is vital. It keeps me alive.
Oh, exactly.
And the goal.
And screening for blood pressure, you know, untreated hypertension and diabetes can lead to kidney failure, cardiovascular disease, stroke, and we're screening for all these maladies.
We've got a telephone number on the screen. People can call this number, get more information on everything we're talking about as we chat with Dr. Charles Modlin, renal transplant surgeon at the Cleveland Clinic. That phone number is is 216-445-7550. You see it at the bottom of the screen, or you can go to the website there, as you see listed, clevelandclinic.org. You can get more information on everything we've been talking about, and /MMHC, Minority Men's Health Center, and all of that. This is your 11th year of doing this.
It's our 11th year. You know, we're trying to break down all the barriers that actually have traditionally prevented a lot of the men from coming in. We're at the main campus of Cleveland Clinic. There's free parking, 93rd and Euclid. So we're trying to break down a lot of the barriers. We have a lot of outside organizations that we're partnering with also.
This is going to be in the Glickman building,
in the Glickman Tower. The Glickman Tower. We have the full lobby. We have the Miller Tower lobby as well. We have 4 floors dedicated to these screenings.
So if you get on the campus of Cleveland Clinic at Euclid Avenue and East 93rd Street, around that area there, you get there, you'll find the front door to get in.
Oh, exactly. This is a remarkable opportunity, and we want the men to take advantage of it.
We've got a minute remaining. What about women? Now, can they can bring these guys along? Sometimes you've had that, haven't you?
Well, exactly. You know, and this is one way in which the program has grown throughout the years. We started the program in 2003. We had about 35 men show up. The last several years, we've had 3,000 or 4,000 men come.
Wow.
And a lot of that is because the women out there have actually been encouraging the men to come in.
Encourage the men, and if you can't encourage him, then grab him by the collar and bring him on in there.
It makes a difference.
It makes a difference because we're trying to save lives. Dr. Charles Modlin, people can pre-register as well.
Oh, yes.
We talked about that.
Yeah, people can pre-register or just show up on the day of the event. It actually starts about 5 p.m. in the evening. We're going to go until about 8:30 or 9 p.m.
That's going to be Thursday, April the 25th, beginning at 5:30, and you'll go on into the evening hours, right?
Correct. And then I'd like to thank the Huron Foundation. They're one of our major sponsors this year for helping put on the health fair.
So once again, put it on your calendars. Thursday, April the 25th, starts at 5:30, goes on into the evening hours, and you get expecting several thousand people in there.
Several thousand men. We've actually added some additional screenings and opportunities for the men to consult with primary care physicians as well.
Free screenings. It doesn't get any better than that. Dr. Charles Modlin and his colleagues will be examining the men who show up and keeping them healthy.
Oh, thank you.
That's the goal. Thank you, Charles.
Well, thanks for
having me. Good to see you, my friend. It's always the doctor is in the house, and it didn't cost you a dime. He's made a house call. Thank you, Dr. Charles Modlin. Appreciate it at Cleveland Clinic. I'm going to take a break in just a moment. When we return, we're going to talk about Delta Sigma Theta sorority celebrating 100 years of sisterhood. I'll be back in a moment.
Is joint pain keeping you from doing things you enjoy? Do you wonder when